So I'm going to go over different types of equipment that you'll frequently see when you're working with trachs. The first one we'll go over is if your patient does not have a trach collar or they're traveling around a lot, moving around a lot, you can use HMEs. So this is a heat moisture exchange. This can just pop on the end of the connector and provide them some moisture so their secretions don't get too thick. If your patient is on oxygen, you can have an HME that is hooked up to a portable oxygen. To help patients speak when they are trached, we use passive valves. The two kinds I have here, this one is just if they're on room air and sits on the end of their trach. This one here, you can hook up to oxygen if they need it. When your patient's on a passive valve, you want to make sure that their cuff is deflated because they're going to be exhaling through their nose and mouth, so the air goes up over their larynx to produce their voice. Their secretions can get thicker on passive valves because there's no humidifications, so that's another thing you want to be sure of. Here we have an example of a suction catheter. This is a 5 French, so it's very tiny. You have a thumb port here and then all the measurements along the suction tubing. So you want to make note of that before suctioning, so you go to the correct ordered measured depth. And then we have some examples of trachs over here. So the 4 I have right here are all Bavonas, and then I do have a Shiley. You can have all different sizes. These are actually Neos, so they're for little babies. They're 2.5s. This would be in more of a toddler. This is a 4.0. Trachs can be uncuffed or cuffed. And I'll actually use this one. So this is a 4.0 that I'll inflate the cuff with. So you can see the cuff inflating there. It's just the balloon at the end. And then the balloon on the outside of the trach will cue you as to if the trach is, if the cuff is inflated or deflated. You always want to make sure that you're deflating the cuff prior to removing the trach. You'll notice that the end of these trachs are a little bit different than the end of this trach. This is just called a flex, so it just provides more of an outer part of the trach. So when kids are moving around a lot, it gives them some more flexibility. And then you'll see this is a Shiley, so this is a lot more common in adult care, but it can be seen in kids. The main difference that I've noticed is that this is just a lot more flexible than the Shiley is very rigid. So like I said, for kids moving around, the Shiley is just incredibly uncomfortable. Shileys have an outer cannula and an inner cannula. So the inner cannula is cleaned daily with trach care and then inserted back in. Bavonas are changed once a week. Where Shileys, the outer cannula is changed once a month.